Good evening. It's Sunday night, so that means it's time for another Savvy Chat. I'm your host, Jen Horangeff from Savvy Cooperative, and we have a wonderful guest tonight. I am joined by Michael McMorris from Pack Health, and they're a great company that helps patients really kind of identify goals and navigate through them. So he's going to help, us sort of think about that, chat through what that's like, what he's seen. He is the director of health advising at Pack Health. He's also a national board certified health and wellness coach, as well as a financial social worker. So Michael, thank you so much for joining us tonight.
Yeah, you're very welcome. Glad to be here and to have a Savvy Chat.
And so we always are in different places across the country or world. Where are you calling in from tonight?
I'm calling from Birmingham, Alabama. Roll Tide, by the way. So.
We got a nice southern drawl. People will like listening to you more so than me. I don't have a New York accent to like counter that, but okay. I'll do my best.
Yeah, I'm originally from St. Louis, Missouri. Lived all over the United States and found Alabama home here. So it's over the past 25 years the accent has rubbed off on me. So.
Well, my family is originally from the South. So it used to be when I would call down to my grandmother or whatnot, I would get the accent. I would just kind of assimilate to it. So we'll see if by the end of this chat, if I'm talking in your same dialect or not. Keep people on their toes. Awesome. Well, I am so excited to chat and to learn more about what you guys are doing at Pack Health. But what I find is everybody's got a story about kind of how they get into healthcare in the first place, since healthcare is not for the faint of heart. So I'm curious, how did you end up working in healthcare even before Pack Health? Like, what brought you here?
Yeah, it's a great question. I went back to school kind of late in life, my mid-40s, went back to school. And I always say I'm much too young to be this old, by the way. But anyway, went back, got my master's degree in social work, had no idea what I was going to do with it. I had an idea that I was going to do some public administration type work, fell in love with some nonprofits I was managing in South Alabama. I was going to do that and try to get paid for it as well. But, got into social work in my education and learned a lot about healthcare and social workers working in healthcare, applied for an internship, had to have a 500-hour internship in a local HIV clinic here in Birmingham. Very competitive. They just don't allow anybody in. So I learned a lot. Spent a lot of good time there working on an interdisciplinary team with doctors, nurses, social workers, pharmacists. It was just a one-stop shop for all things related to managing HIV and also hepatitis C, HCV. And I really fell in love with that. And so left there thinking I'm going to get into healthcare somehow, some way, and found this place called Pack Health as a new startup. They were operating probably about 8 months or so before I joined them. I was employee. I joined with 4 other employees. I was either employee 7, 8, 9, or 10. I don't know. I enjoyed. I like to think I'm employee number 7. So,
well, so let's go back a little bit too, because I think there's some things to unpack there, if you will. No pun intended. But so like HIV is a very complex condition. It affects people both mentally, physically, socially, financially. And you talked about how you're kind of working with multiple sort of professionals and kind of the healthcare ecosystem. Okay. And what I find as somebody who also has like a complex condition, there's just so much going on. And as somebody like yourself, a professional sort of stepping into this world, I feel like some people might kind of run away from that. Like, oh my gosh, there's too much going on and these are really complex patients. So what motivated you to want to get involved and then go on to be part of Pack Health? But how did you feel kind of when you kind of looked under the hood and saw how complicated these things can be?
Yeah, well, it was very challenging, of course, like you were talking about, but the challenge is what drew me in. I'm not one to shy away from any type of challenge, and I love to stretch myself and to put myself out there in roles that I think that, wow, I'm really getting myself in deep here. But that's what I thrive on. I don't shy away from that. So it's really what motivated me to kind of get involved with it. Also, getting involved in some research. The research project I was a part of there was around linkage to care. And so it was a really good time to join them and to get involved with them. It was really rewarding also, taking somebody from diagnosis and then link them to care, which can be a bit of a problem, getting people from diagnosis to care seamlessly can be a bit of an issue, especially with many chronic conditions, but especially hepatitis C and HIV.
Yeah.
So to be a part of that, to take somebody from diagnosis and talk to them one-on-one about their condition, talk to them about how we can sign them up for programs. And, HIV is a unique chronic condition in America because it's all care is 100% paid for by the government, essentially, if you can't afford care. So it's really good. It's really rewarding to hear somebody think like, I don't know how I'm going to pay for this. I know drugs are real expensive. I don't know what to do here. I said, well, let me just put all fears to rest here. We can get you signed up for any program and take care of it all. So it's really rewarding to be a part of that.
Well, so that's really interesting because as I understand it, that's kind of the things that PAC Health sort of seamlessly helps you do. So we'll kind of dive in, but like, what's a quick pitch for like PAC Health so that our listeners who aren't familiar with what you do kind of get like the quick sort of landscape, and then we'll unpack it a little bit.
Yeah, we are a digital health coaching company. We partner with people who are at risk or are living with a chronic condition. And we assist them with reaching their personal health goals, whatever they might be, to help them to better manage or self-manage their chronic condition as well. We're non-clinical. None of us are doctors. We do have medical professionals on our board, as well as we have a medical director that's overseeing things as well. But our specialty is in behavior change. And so taking somebody, because we know that that health behaviors comprise 50% of all outcomes when it comes to managing a chronic condition. So that's our focus. If we can help change people's behaviors and help them to reach their personal health goals, whatever they might be, then it's a win-win.
That's a win. Yeah. So, I know that there are other sort of behavior change programs, not necessarily what you guys are doing, but a lot of people are now into like, how can we really help people change their behavior? Because it's hard. It is hard to actually get somebody to change something that might be ingrained and they've been doing things in a certain way. So as I understand it, members, that's what you guys call them, when members come to PAC Health and join, they go through a 3-month program and you work through some different kinds of topics. So what kind of topics would people cover? So if I were to sign up, like what would I expect to go through?
Yeah, you're right. We do the initial, some people do, depending on funding for their program. We do have 90-day programs. We have 180-day programs. We also have fully year funded programs. So depending on, but no matter the duration of the program, we all start with this 3-month intensive phase of the program. And so during that time, we're talking about first things first is talking about setting their goal. What do they want to try to achieve in their health? Once we get past that and we develop a plan around that, we start formulating strategies around that. And so we'll talk about things like whatever it is to help them reach their goal. We'll talk about things like managing their medications or eating healthier, getting more physical activity, managing stress, sleep, social support, making sure they're getting the right care. Also, making sure they have the right healthcare professionals on their care team and they're seeing them on a regular basis. Also, we talk about financial aspects. As you mentioned earlier, I'm a financial social worker, and we have 4 other people who are also certified on staff of 30 health advisors. And so what we also talk about health budgeting and what it means to live with a chronic condition. As you all know, can be very expensive. And so we help people to develop plans around that if they need it.
Yeah. And so, you talk about a program. Just to be clear here, is this like a group program or is this a one-on-one interaction?
Yeah, it's one-on-one. All of our members are paired up at enrollment whenever they enroll in our program with a dedicated health advisor. So it's one-on-one, weekly. Well, typically it's weekly engagement. We'll have about 15, 20-minute phone call with individuals where we're talking about one specific topic or a topic that they want to talk about on that particular day. And then we also follow up with them by text messages as well through the week. So. Mhm.
And so you mentioned health advisors, and you're the director of health advising. So I want to dig in here a little bit to understand what role do health advisors play for somebody that, like me or somebody else coming to Pack Health? Because from kind of where I sit, I see so many different technologies and AI and machine learning out there for kind of bots to be interacting.
Yeah.
And you talked about text messaging, but that's what, is that a human texting them? And why is it that somebody needs a health advisor? Why can't we just chat with our computers and algorithms?
It's a great question. Well, AI is great, and we're constantly looking at it as how we could integrate it into our health coaching model as well. Not necessarily replacing our health coaches or health advisors, but helping us do our job better. But just by relying on chatting with a bot or AI is not very. They're not very empathetic. Let's put it to you that way. So. And there's there's plenty of research out there that talks about the issue of loneliness and how it impacts health and health behaviors as well, and health outcomes. And so, having somebody connect with somebody on a weekly basis, talking about their health, getting it out in the open, whatever that they want to chat about. Because a lot of times people are left throughout the year. They might see their doctor 2, 3, 4 times tops usually. Sometimes it's a 15-minute quick conversation, and the doctor might tell them, hey, you need to eat healthier, you need to exercise, you need to do this and do that, and just don't really have the time to break it down and to unpack that for them. And so that's where we come in.
Yeah, and I think that's great. And so, I mean, certainly in your role as a social worker and doing this and as the director, I'm sure that you heard just so many different health journeys and where people are coming from. And, I'm a patient myself. I kind of know sort of my own motivations and kind of the things that I would want to work on. But my guess is you're starting to see some themes about what you hear a lot about what patients are trying to reach, whether it's weight loss or things like this. So if you had to say, maybe what are like some of the 3 most common goals that people are working towards?
Yeah, we do a lot of internal research, as you can imagine, and we just did one not too long ago on goals. And I'm a patient myself as well. I manage very well, thanks genetically have dyslipidemia as well as hypertension, and so manage those 2 conditions very well. So I understand what people go through. But yeah, so and my doctor always told me, hey, you need to lose weight, right? You need to do this and do that. So, but weight loss is the number one by far goal that people have or to reach or try to manage. Also, number 2 is to get more exercise. Sometimes people, want to just work on that. Getting more physical activity. And number 3 is developing healthier habits, kind of a broad goal that people have, but it could encompass things like eating healthier, managing stress, getting better sleep, getting more exercise, whatever it may be.
I'm curious too. So those are the common ones. Are there any goals that you've heard that maybe are very different or surprising or more specific? I'm sure you've heard your fair share of some interesting goals.
Yeah, absolutely. I've had people. Had one lady just one member had talked about, I just want to get more energy. I'm like, wow, that's really interesting. What does that mean for you? What would success look like? So she began to talk about her life and how she's just lethargic a lot of the time and just wanting to get more energy to get through the day to be a better better worker, better employee at her workplace, as well as not be so drained when she gets home, things of that nature. So yeah, things, yeah, absolutely. As you can imagine, working with individuals and working with people, they can be very, very unique, and goals can be very unique as well.
And I think that's interesting too, because goals can change on sort of a day-to-day basis. So do you get people that they join the program for, be it 3 months or however much longer the program might be, and they change over time? Is that something that you see happen?
Absolutely, absolutely. Especially if we work with somebody over the course of a year, those goals can change. They might try to attempt to lose some weight and not be very successful. We've had that happen. And so they begin to change, begin to rethink, their goals in general. And so begin to focus more on health habits, or healthier habits versus just the weight loss. And so we tell people, look, if you want to focus on the health habit, then, then the weight losses should come, later on. So let's just start there. It's a little bit less stressful on people, because you set a weight loss goal, that scale in the bathroom is, not everybody likes to step on that scale every week and try to check in on that. So it can be rather stressful, and that stress in and of itself can hinder success in that specific goal. So focusing on health habits, things of that nature. Yeah, we see that happen all the time.
Yeah, and I mean, you just kind of talked about sort of something that can happen when you're not reaching your goal. So you're seeing all these different people. I'm sure you also are noticing sort of some of the same sort of common barriers or pitfalls that people have accomplishing those goals. And they might be kind of goal specific, but what do you kind of see so that we know that it's not just us that we're having issues?
Yeah, absolutely. Well, number one is time, as you can imagine.
I need more of that.
Yeah, absolutely. Need more time. So people have busy lives, and finding the time to fit in with managing their, family, work, shuttling kids here, there, and everywhere, and then trying to find time for themselves is really a struggle. And so we really use a lot of interviewing techniques to help people arrive at where they want to be. Some of the best compliments I get as a health coach working with people is that they tell me, well, you help me really to think through a problem that I'm having and arrive at a solution that they come up with versus me coming up with the solution. So I say, hey, if I could do that, I won that day. So which is great. And so yeah, so helping people find that time. It can be really tough to cook healthier meals, for instance. Can be really finding that time for exercise and things of that nature. Number two is, I think, self. A lot of people tell me that. What's one thing that could hinder you from reaching this goal? And they say, me.
Yeah, that sounds about right over here on this side of the screen.
Yeah, absolutely. Just finding that motivation to change. And we have a long conversation around that as well. And then number three, their condition might hinder them from reaching their goal, whatever it may be. We talk to people with many different conditions. I think the last time I checked, we had like 23, I think, conditions that we help people manage. So, and it runs the spectrum of healthcare. Immunological conditions like rheumatoid arthritis can be very debilitating and can be really hindering individuals with, with exercise and things of that nature.
Right. And then, as somebody with arthritis, I think you can get in sort of this deep spiral of, people telling you need to exercise. You may intellectually know you need to exercise, but when you aren't feeling well and your joints hurt and you're exhausted, you kind of can go into this dark place where it just feels like you can't get out of it. Like, how do you help somebody kind of see that there are little steps they can take, or are there? Or is it just, that's it until you start feeling better? Because I've been in that place.
Exactly. Our whole philosophy around behavior change is not changing everything at once. It's really a recipe for disaster. So what we do is we're an advocate of tiny steps. BJ Fogg was a researcher out in Stanford University in California, came up with this tiny step method of, hey, just starting small. If you're not exercising at all, start with 5 minutes, a day, or 5 minutes, couple days during the week. Just get moving, just get started. And it might not be, I say exercise and we automatically think going to the gym and working out, weightlifting, No, I mean, it could be just moving more, doing some yoga, doing some moves or things of that nature. We send out what we call a PAC toolkit to individuals who enroll in our program as well. And inside there are some tools, and we provide this stretch band that people can use, and people really like it. We produce in-house videos. We could email them as well that they can see, and really easy to use. So they can start using the stretch band. And sometimes just sitting there watching TV and just using the stretch band is just a good start. And then before you know it, people are off and running.
Yeah, I mean, I don't have yours, but I travel with my stretch band or TheraBand or whatever you want to call it. It's up nicely, and it's good just to get a little bit of movement there. And even, I've noticed myself, I'm very busy, obviously, with Savvy, but I start to take more and more of my phone calls when I can walking. So for those people who have heard background noise, they know that I take a lot of my calls walking to try to multitask and kind of fit that time and exercise in.
Absolutely.
So you mentioned that you have, I think, about 23 different conditions that you may have worked with, and my understanding, and you mentioned that you have different programs. So can anybody use your service, or do you cater more towards certain conditions that our listeners could tune in and think about if they could be, able to get access to some of these amazing programs?
Yeah, we currently we have, right now we're working with health systems, employers, one insurance company here in Alabama for pilot programs. So we're generally engaging people associated with those projects. But yes, anybody can enroll if they would like. In fact, we do have some free programs available. These are funded programs. We have, last time I looked, have type 2 diabetes, pre-diabetes. There's a cancer, multiple sclerosis, rheumatoid arthritis, IBD, and HCV, hepatitis C. So those are free. People can go to our website and look at those. I'll provide that information if you like.
Absolutely.
In addition to that, we have 15 other programs that we do cover as well. And again, it can be a pulmonary condition, could be cardiometabolic, could be immunological, and even we have an oncology staff here as well. So yeah, we kind of cover a lot of them, and we're adding more all the time, it seems. So.
No, I think that's terrific. So, we can put in our comment section here some direct links, but if our listeners want to get more information, what's your website? Where can they go to find out a little bit more?
Yeah, they can go to www.pachhealth, PACKHEALTH.com and /free-programs. And that should take them exactly to the website, exactly to the landing page where they can just click and get to the right place.
Amazing. Well, this is awesome. And I know that our listeners will hopefully take advantage of some of this because they are free programs, and it's great to just dive in. I actually have met, we didn't talk about this, but I have met somebody who's been through your program and heard that, they lost a lot of weight. They really felt like it was kind of like their own just health coach to help them kind of reach those milestones, and we're sad when the program is over. So I think it's a testament to what you guys are doing is helpful and it's working. And so I hope our listeners will take advantage of that.
Great. Yeah, it sounds good.
So before we close out, we always ask our listeners the same rapid fire questions. So I want to personalize you guys and let people know that you have lives outside of helping people. So curious, what do you do when you're not being savvy and helping others?
I really enjoy biking. I've gotten to biking here, I don't know, almost 2 years ago as a form of exercise, and I really enjoy that. But besides that, visiting one of our six craft breweries here in Birmingham, Alabama, is another thing I like to do in moderation.
Yeah, well, you got biking and some brewing time, so it kind of
Yeah,
equals out. Your health coach would probably be proud of you, right?
absolutely.
So, what's something quirky about you that maybe people don't know?
Yeah. I've had a varied career path in my life. I started out as a funeral director. I was also a truck driver, drove 18 wheelers across the country. I was in the ministry for almost a decade, and now I'm a health coach. So I've had 4 different careers in my life. So
Wow, that's fascinating. Well, hey, diversity is the spice of life. Isn't that what they say? Something like that? Variety?
yeah,
Something.
absolutely.
All right. Well, you're certainly in the thick of healthcare and you're hearing from so many different people. So, curious from your perspective, what do you think one of the biggest healthcare headaches or challenges that we have to address is?
I think it's a very broad term, but I think I landed on chronic care condition management. I think is really a key issue to tackle. Recent CDC data states that 6 in 10 of us have a chronic condition, and 4 in 10 of us have two. I'm included in that. I'm one of them. So, but those are also the leading drivers of healthcare costs today. And by the CDC's estimation, $3.3 trillion goes towards managing chronic illness today in our nation.
Yeah, well, I certainly am one of those individuals, and I would love if my costs came down. So I hope that that's what we're all working towards. All right, my favorite question. I'm always curious what people think up because I do give you guys a heads up to pick out the song title that you think best describes the current state of healthcare. So what did you pick?
Great question. I have to go with one of my favorite artists, Peter Gabriel, Big Time.
Nice,
Big Time.
excellent.
Because I think that I think healthcare is driving 20% of gross domestic product in America today in our economy. So healthcare is definitely big time.
Yeah, yeah, that's a good way of putting it. Well, that will be going on our Spotify playlist. For those of you who have not yet heard, we do have a Spotify playlist, our Savvy Healthcare soundtrack. You can also go to our website, savvy.coop/savvy-soundtrack to see all the different songs. We have things from John Lennon to Cardi B to Alanis Morissette and now Peter Gabriel. So it's great to kind of get us all motivated to go out there tomorrow, Monday morning, and hit the ground running and try to make some strides. So
it's a great exercise song too, by the way.
there you go. So while you're biking or just getting motivated, it's a good sort of wake up song and get yourself going. Well, I can't thank you enough. This has been an amazing discussion, really kind of breaking down the fact that everybody has different goals, but there are ways to take those baby steps to get towards them. So any sort of parting words for our listeners here from you, Michael?
No, other than I'm along, I started out myself, my own weight loss journey 4 years ago. I joined Pack Health, and now I'm proud to say 4 years later, by using the same method, use the same things that I teach my members as I coach them. And, along the way, I've lost 35 pounds, really, really doing really well. My doctor is very happy. So he's happy, I'm happy. So.
Well, we want you happy first. So, well, that's amazing. Thank you so much for joining us. And thank you to our listeners. Hopefully this will motivate you to go back out there tomorrow and make those steps towards your health and your happiness. Tune in next week. We're joined by Rachel Traubman from Ouchie. We're going to be talking about chronic pain. I know we've got some chronic pain sufferers and survivors listening in right now. So I hope you guys will join us for that one as we are starting to close out this year. It's been an amazing year of Savvy Chats. So tune in again next week, and we thank you guys for joining. Until then, stay savvy.